hello, Bay Area. You're listening to Radio Mirchi 3010 AM, and this is your one and only Tikhi Mirchi, which is RJ Mirchita. And as you guys know, yaar, કે I am back અને અમે પાછા આવ્યા છે back. As you know, કે આપણે break તો લેતા નથી. So this is a little bit early, and I do understand. But શું કરીએ? આજે આપણા special show માં special doctors આવવાના છે, and that too they are from Florida. એટલે as you know, કે Florida માં તો અત્યારે it's going to be like what 10:30. So, and doctors have given us time. And first of all, I'm super grateful that they have volunteered to come on this show. And second thing, that the topic is very, very, very interesting. The reason is because, નાનપણથી આપણને આમ ટેવ હોય બોલવાની કંઈ પણ થાય ને લાઈફમાં મને પેઇન થાય છે. નાની નાની વસ્તુમાં આપણને પેઇન થઈ જાય છે. કાં તો આપણે હર્ટ થાય, કાં તો આપણે પેઇન થાય, કાં તો આપણું માથું દુખતું હોય. આપણે માથું દુખે ને તો આપણે શું બોલીએ ખબર છે? અરે મારા માથામાં પેઇન થાય છે, પગમાં પેઇન થાય છે, હાથમાં પેઇન થાય છે. And I'm like, okay, this is like a part of my life, right? It's a routine. Like I've accepted pain as a part of my life. Okay, like, phone a friend. Call a friend to go pain થાય છે, whatever, pain થાય છે, PTO લેવી છે, pain થાય છે, sick leave, pain થાય છે. So today's topic is literally involved and it's going to revolve around COVID and pain management. અને તમને ખબર છે કે there are special doctors who deal with pain management? Well, I didn't know that. It was quite new for me. But there are doctors here who specialize in just pain management. So today we have with us Dr.Modha, who is founder of Gokul Group of Hospitals, Rajkot, India. But along with him, we have special doctors from Florida. We have Dr. Vajubhai Rajyaguru and Dr.Neil Rajyaguru to talk more. મેં કીધું ને પેઇન. હવે તમને પેઇન થાય ને તો તમે કોમેન્ટ કરજો કે શું પેઇન થાય છે એટલે અમને ખબર પડે. તો let me give a little bit introduction about Dr. Vajubhai Rajyaguru. Dr. Rajyaguru finished his med school from MP Shah Medical College, Jamnagar in 1986. As usual, હું કહું છું આ શોમાં કે if I introduce any doctor on this show, I need to write a book because their achievements are not just gonna fit in one line, right? So 1986, he specializes in pain management. He is board certified by American Board of Anesthesiology and American Board of Pain Medicine and has been practicing pain management for the last 25 years in the area of Orlando, Florida. You know, Miami Beach? તમને બધાને ખબર હશે ને ક્યાં છે? એટલે they are from there. હવે આમાં શું મારે વધારે કહેવું? But not just this. He also enjoys doing a lot of charitable medical work. અને એમની સાથે છે Dr. Neil Rajyaguru. So a little bit about Dr. Neil Rajyaguru. Dr. Neil finished his medical school from USF College of Medicine, Tampa, Florida in 2016. He completed his PG training for physical medicine and rehabilitation, PM&R, Albany, New York in 2020 and is board eligible. We have a very young doctor on the show today. And he enjoys exploring new areas and also participating in charity-related events. So this is just a little bit about amazing doctors that we have from Florida. And now I would like to invite Dr. Modha to share, as usual, statistics about COVID. એટલે કે world COVID statistics worldwide, US, Brazil, India, Gujarat અને રાજકોટ. So over to you, Dr. Modha.
Listeners, good morning everybody. Good morning in India and good evening in US. So it's my pleasure to welcome my dearest friend, Dr. Rajyaguru, both Rajyagurus, Dr. Vajubhai Rajyaguru and his elder son, Dr. Neil Rajyaguru. So this is the Corona Awareness Day 24. We are continuously on air daily since last 24 days. So giving some statistics about the world, USA has got 2,253 new cases of COVID and death was 88. Today I couldn't get the statistics of Brazil because it was not mentioned on the internet. So coming to India, the new cases were 1,74,662 and death was 3,167. this is a declining things, or total number of cases and total number of death. But we have to learn from Australia. Everyone has to, I should say, learn from Australia. Only 10 cases in Australia and no
Excellent.
death. This is continuously I am mentioning since last 10-12 days. There is no death in Australia and cases is in double figure. It has not gone in triple figure even. So hands off to Australia, hats off to Australia. And now coming to Gujarat.
Mm-hmm.
Its total case is 3,285 and death is 44. This death has come down, but the total cases has little risen, about 100 in Gujarat. Ahmedabad, there are 522 new cases. Surat, 423. Baroda, 462 new cases. Rajkot, 215. Bhavnagar, 95 only. Bhavnagar is the only place where the things comes into double figure. So, good for Bhavnagar people. Jamnagar, 103 new cases and Junagadh, 202 new cases. So, these are some statistics from India and abroad. It is a declining trends in the COVID, and hopefully now the hospital in Rajkot have plenty of beds. At a time, I could not arrange a bed for my friend's brother, and I'm still feeling sorry that in spite of having 2-3 hospitals in Rajkot, I was not able to arrange a bed. So this was the situation at that time, almost a month ago, Vajubhai.
3
Doctor-
weeks.
Almost a month before, and now the thing is that we have got almost 20-30% vacant beds in our hospitals. So this is the situation now. One sort of thing, it is a good situation, and we pray God that it should continue. Over to you, Mirchita.
Already, thank you, Dr. Modha. And just to tell all our listeners, કે see, the situation is improving. એટલે મેં first show માં કીધેલું કે આ સમય પણ વીતી જશે, right? This time shall pass by, right? So this is a good time. Again, in just 23 days, you are seeing the difference, right? And we are telling you what's happening, right? Every single day. And I should thank Dr. Modha. But we have doctors here and we are getting late. So before further ado, I would like to invite Dr. Vajubhai and Dr.Neil to talk a little bit about themselves, and then we can start the question answer.
Well, basically, I came in this country in America in 1987, and I went through some research in vascular surgery, published some articles, and then started residency in general surgery, did 2 years in general surgery, and after that, I joined anesthesia and pain management, and I finished my residency in 1994. And subsequent to that, I took my written board in anesthesia, then oral board, and then I took pain medicine board. So I'm board certified by all primary, that is anesthesiology, and subspecialty, that is pain management. And I have been practicing interventional pain medicine for last 25 years in Orlando, Florida. And that's about it. Dr. Neil is going to tell more about himself.
Yes, Dr. Modha.
Vajubhai, why did you select Florida? Why not California? Why not Chicago? Why not New York?
That's a good question. Well, Florida, there are a couple good reasons. One is that Florida, as we know, that when people retire in America, they move to Florida. So there are a lot of elderly people here. And as we know that in our profession, the more elderly people you have, the better your business runs.
Oh.
That's the one reason. Second reason is climate. It's a nice and warm climate. The climate is very comparable to India. And the third reason is that cost of living in Florida is much lower than New York and California. And there is no one important thing is there is no state tax in Florida.
Yeah.
Oh man, Dr. Modha, you just nailed the question. The first question itself, you nailed it.
Yeah. He's my friend, so I can ask him, no? Said bluntly. This is a blunt question. It's okay.
I think the listeners are having good fun because Khyati Thanki has already said she's liking this conversation. So thank you, Khyati, for liking this conversation. And then, yeah, I'd like to invite Dr. Neil as well to talk a little bit about himself, and then we'll start the questions.
Oh man, I don't think I have a life story as much as yours. Let's be honest there. But let's see. I mean, so I guess you could say I had the luxury of growing up here in the U.S. So I went to medical school in Tampa, doing a 7-year program. So that pretty much I fast tracked my way through medical school, and then got a residency position in Albany, New York. So the position in Albany was in 2016. Did that for 4 years, and now I just finished my boards, so I'm waiting for the results of that. It'll probably come in another month and a half or so. I guess you could say during the training, that's when COVID became more prominent in, early 2020. So I kind of had a little bit of a taste of what the inpatient side was through close accounts with people there. And, we'll talk a little bit more about that tonight during the show, but, I mean, I don't have any experience in yours. Let's just be real.
Well, Dr. Neil is very energetic and he's very eager to learn and very smart doctor, young doctor.
Yes, Dr. Modha.
You see, Dr. Vajubhai comes every year to India. He does a big pain relief camp.
Wonderful.
And he treats lots of more than thousands of patients in his native place, Rawal, Khambhalia, and he comes to Rajkot as well. He delivers good lectures for us, and he has donated radio frequency generator machine to PDU Medical College, Rajkot. So
Very
Vajubhai
nice.
is that much generous, and we appreciate it, and we pray God that he should continue this sort of charity.
Thank you.
Please, Gary.
Thank you. Great intro. So now the most interesting part of our show is, this is the first question and it is really interesting, which is for both the doctors here, is how has COVID affected your life?
Oh, wow. I think we both have different experiences with that one because we were in different places when this started off, right?
That's right. You go ahead and then.
So I guess I'll talk about when it first started, only because it might put some perspective. When it started for me, I was up in New York. So we were getting slammed. I think just like India was getting slammed several weeks ago, with record-breaking cases. And I think the only difference was back then, no one knew anything about COVID when it started in March 2020. So one day we were able to walk around mask-free, and all of a sudden, mask mandate. So really, social interactions with social distancing, not being able to even go outside and feeling safe. I think that was probably the biggest thing that changed in our life. We're very, what you call social society, especially us Indian people. We like to go out and go to other people's homes, have some dinner, go travel. Like we go to India every year almost, right? So that really put a dent in our plans there, I would say.
Yeah, the COVID basically affected every facet of the life, more so with the doctors. In my case, I'm dealing with the elderly patient who are in chronic debilitating pain. On one side of me is telling me that I should go and take care of them. And other side was telling me that it is very risky because we didn't quite understand or understood at the time how the COVID spread and what happens. So it was really a big dilemma. Although I did continue practicing pain management, not every day, at least once a week. I used to go to clinic, and the patient that that were in dire need of the pain management treatment, I did see them. I scheduled them. Sometimes maybe a one secretary or sometimes nobody. I went there by myself and treated 3 or 5 patients, whoever, because my main goal was to prevent them going to the hospital. Because if they are in significant pain and they end up in the hospital, that's the worst place to be at the time. Because we needed the hospital bed and we didn't want to expose these elderly people or elderly patient to the COVID. So that significant change was first. The other one, as we all know, that even if you want to get a cup of coffee, you would hesitate to go to a convenience store and get it like the way we normally do. So the whole life was upside down, basically, at the time.
Correct, sir. Thank you for sharing your experience. We'll take the next question, which is, since all this dilemma, and even I remember myself not going out for like 10 days straight in a row. It would just be like DoorDash the food, sometimes just like walking in the backyard. So it was crazy that time. And then we had California fires, the atmosphere, the air pollution, and it was earthquake.
Oh, yeah.
Like California has like seen every worst thing in 2020, not just COVID. But taking the next question, as we discuss this visit, which is any change in your clinical practice because of COVID?
Well, basically, there are some drastic changes. Like if you go in the waiting room, the chairs are spread apart with the social distancing. People are wearing masks, hand sanitizing, then temperature checking. We used to do that at the beginning. So those kind of major changes. The other changes are that I really wanted to see the patient who cannot wait or who cannot bear the pain and need some treatment. So that was like more on emergency base as opposed to a routine patient care. So those were the significant changes in the clinic setup.
Yes, Dr. Modha.
Yeah, Vajubhai, how many days a week you used to go to your clinic? Because I have stopped going to my hospital since over a month.
Oh,
Basically, at least minimum once a week, sometimes 2 to 3 times a week. As far as I remember, in a month of May, there was, I think, 2 weeks that I did not go to clinic. That was the longest shutdown clinic I had. But other than that, most of the time, once a week, some twice a week, depending on the volume and need.
all right. So let's move on to the next question, which is, what do you think are some useful steps people can take towards preventing COVID infection?
I mean, I think we've heard a lot of the advice kind of shot around on social media, TV, and even on your show. You've had plenty of guests, I'm sure, who have been talking about it, but simple hygiene, washing the hands, wearing a mask, and, being mindful of what objects one are touching, for example, like whether it's our clothes when we're going outside and coming into the home, if you're going takeout and touching like the plastic bags or the containers, there've been a lot of studies when, like for the plastic containers, usually it stays on, I think, 24 to 48 hours, maybe 72 hours before one can touch it. So just kind of being more aware of where you are, what your hands are touching, and where you're putting your hands after you touch it. If someone gets a stuffy nose, don't just go initially and go wipe your nose. Either have hand sanitizer, wash your hands. It sounds really simple, but simple things can get us far along, during the pandemic.
Mm-hmm.
And other thing is, if you suspect a patient has temperature or patient is sick, you want to isolate that patient from rest of the people and advise them to go to hospital and those kind of things.
All right. So yeah, this is extremely important point that again I want to emphasize that it may be like nowadays people are taking it very light here in California. It's like, oh, let's just remove the mask, let's just move here and there. That's fine, but no, let's just, what I want to say through this program is let's just continue following those basic hygienes, right? Let's just not forget that since, oh, there's no case here or the cases are declining, let's not follow those basic sanitization that we were doing it even during the peak times. So just a note from my side. And moving on to the next question, which is what are some signs one can monitor at home to determine if they should present to hospital for further evaluation?
I mean, I guess I'll talk about when the COVID started, I was more on the inpatient hospital side of the care up in Albany. So, between either myself or my colleagues, we all used to have to take call, or they would call me asking what should they do. So basic things, losing breath, if someone's feeling short of breath, high fever, if someone just feels, if they look confused, you saw them one day, they're talking normally, and the next time you see them, or they just feel, I don't feel like myself. I think, the first 2 points I made, that sounds pretty obvious, but if someone suddenly seems confused or just not in the right state of mind, that could be because of COVID or any sort of other infection. So I think that's one overlooked fact that should probably send someone either to at least a physician's office or to the hospital, if they can't get into their doctor's office. I mean, as a community, someone who's not a physician, I mean, what else would you I'm thinking those are kind of like simple things one can see.
Yeah, if somebody, basically for general population, if they don't feel right, and I'm sure person know when he or she doesn't feel right, meaning if they're feeling kind of body ache, feverish, temperature, dry cough, all these symptoms, that is not a normal symptom. If somebody wake up with those kind of symptoms, then those are the signs and symptoms that one should not ignore, and should get the tested, make sure they are negative or they have COVID. And if they have COVID, it's very important to isolate that person from the rest of the family members, so that the rest of the family members hopefully would not catch it.
I think this loss of taste is a pretty new symptom for COVID
Exactly.
as well. I think
Right.
we forgot to mention that. So
Yeah, that is very important. Sometimes that is the first symptoms appears.
yeah.
That person just come and say that I don't taste anything. That's a good reason to have a COVID test done.
All right. Thank you, Dr. Rajyaguru and Rajyaguru. So we have a listener who is watching us live, and she has asked an interesting question. I guess we have already discussed this a lot, but still, since we are discussing one more time, it's always good to discuss it, which is, can Walmart grocery shopping spread COVID-19? This is Beena Thanki. She's watching us live and asking us.
Well, from what I understand, that all the grocery stores, they have a air conditioned filter that is put it in such a way that it filters the air from the store itself. And same thing applies to the restaurants. This was on the TV. So if that is true, then the spread of COVID would be much less, provided that they maintain the social distancing, because that's how the most important part is the social distancing. I did hear somewhere on the TV as well that flying in the airline versus going in the store, they have pretty comparable spread of the disease. In other words, they take all kinds of precautions. So as long as the social distance is maintained, catching COVID just because being in Walmart would not be an issue.
Right. So it looks like it is safe right now. And Dr. Modha wants to say something. Yes, Dr. Modha.
Yeah. I agree with Vajubhai, but still, if you don't maintain social distance, don't wear a mask, or don't wash your hands or wear gloves, there are chances that you get COVID.
Absolutely. Yes.
Because you filter the air. but you can't filter the people
Right.
who is coming to
That's
the
right.
Walmart.
Yeah. No,
So,
social distance,
uh,
mask wearing, and maintaining the hand hygiene. Those are very, very crucial points.
Yeah. So I hope that Miss Beena Hanky, we have answered your question. Yes, Dr. Modha.
Bina is my sister's daughter. She is in USA.
Oh,
Yeah.
I see.
My
That's why she is.
Bhanet, and
Uh-huh.
she is in USA. Vajubhai.
Very
Very
good.
nice.
Yeah.
And she is also asking us one more question. So let's just take it as your Bhanich is here, which is how much safe to flight that are all full, I guess. That's what she's trying to convey. How much safe it is to travel when the flights are full?
Well, as far as we know, so far, I haven't heard somebody got positive just because flying in an airplane. The other thing is that they have the FAA have also made some changes in the airplane filtration system, and air is pretty. There is every
It's like every 6 seconds. they
6
say.
second, right?
Yeah.
It circulates through the airplane and filter through the filtration system, and pick up all the viral particles and stuff like that. So that's a very efficient system, and I think people used to wear masks. I'm not sure if they're still wearing masks at this
On
point.
the planes, at least in America, it's still mandated.
It is.
Any
okay.
public transport, it's still mandated to wear a mask.
Right. Okay. So flying is not
Alternate
that.
seat or something like that.
That used to be the case, but all the airlines here have stopped doing that as of, I think Delta was the last one. They stopped May 1st. We're doing alternate seats. Previous to that, they were doing that. In fact, they were doing it like 2 seats per row or 3 seats per row, or some alternative setting. That has since been stopped. And then CDC also came out, and that's led to a whole other set of full freedom in their eyes of the airlines.
I think there is so much demand. People want to fly. They want to get out of their house and go somewhere.
Yeah. People are fed up. Even in
Fed up.
India, our kids are tired. Everyone is fed up. They want to go out. They want to
Yeah.
go out. School is not open. So
Right.
there is a pressure on the parents to take
Yes.
them out. So we go to our farmhouse.
Yes. Yeah. In America, they call it a pent-up demand. The
Yeah.
demand for everything is growing so fast.
Yeah.
That is shopping, flying, going on beach, going to restaurants, going to Disney World. All this thing is people are just can't take this COVID anymore. They want to get out and have fun.
Yeah, that is so true. So I live nearby a beach, right? I mean, not nearby, but it's kind of like an hour away. So it's Santa Cruz Beach. It's very popular. Even during COVID, they opened it like twice. And then there was surge of cases. They had to shut it down. And people were protesting here that, okay, if you don't open the beach, we're going to protest it. And I was so shocked, even in like the peak times, people wanted to go there for surfing. Like it is. Yeah, so Santa Clara County did say that, okay, it's a different county altogether, Santa Cruz County. So they said, okay, we will open it, and the government said, okay, no, you cannot do this. So they kind of said, okay, this is not going to happen. But people were protesting like crazy. They wanted it. So you guys are right.
Well, basically, isolation because when we were in COVID situation, we were isolated. And isolation causes anxiety, depression, sleep problem, and all kind of family issue. So that was the one of the good reason and main reason that people wanted to get out of their house and do something.
Well, Florida had another story with that, right? We had the reputation of being on national TV with beaches being so crowded that.
Yeah, exactly.
I know, right?
Opposite, right?
Florida was all open, and
Yeah.
a lot of people were telling me, "Oh, you want to go out in COVID? Just go to Florida." And I was like, "Seriously, they're open?"
Yeah, Florida was open. You're right. Yeah.
Yeah. So some interesting stories from our personal experience, since we are US folks around here, Dr. Modha. I don't know what happened in India. Do you want to share if Dwarka was open or if Verawad was open? Nothing?
Everything was closed.
Oh.
And they were arresting. If you go to the Shivrajpur beach, you will be arrested.
Oh,
It was
man.
like that. So nobody was going out during the lockdown period, initial days. But
Yeah.
later on, they started relaxing. You can go for 6 hours, 4 hours, like that. So that was easy now. But initially, it was difficult. But now, gradually, it is improving. But still, we worried traveling, you go by car, you go to the restaurant where you never know what is happening. So either you take your food together and go to the beach. But to go and eat in the hotel or restaurant was not safe. But nowadays it is improving, it seems. And people are going out more and more, at least on weekend. And they are enjoying.
Yeah, I want to add one thing there. When there was no guidelines about whether it's safe to eat outside or not, I was so used to eating office food, right? Like I was not cooking at home, and suddenly work from home, so I had to literally cook at home, and I was like, man, this is so painful. Now I was so spoiled. But I actually started cooking, and I enjoyed it. That was like good part of the story. But yeah, I wouldn't even touch any bag. I wouldn't even touch anything outside, not even a plastic bag. It was like, no, no, no. So that's the COVID experience. But moving on to the next question, which is, what are some immediate or short term dangers one could face after COVID diagnosis?
Well, there are plenty, unfortunately. I mean, one runs the risk of, getting like blood clots. That's probably one of the biggest things these days.
Right.
I mean, you can get muscle weakness, you can get other short-term things, decondition just in general, by being in bed for many days, especially for those who get a pretty moderate to severe case of the COVID. If you're in a hospital bed, like an ICU, you can develop pressure sores, and that can become, even if you get cured from the COVID, you can get this pressure sore that can get infected, and you could be on long-term antibiotics or require surgery.
And now with the new mucormycosis, that fungal black fungus, so that's a short-term danger is of getting a steroid injection, and subsequently, I think diabetic patients are getting those black funguses. Dr. Modha, as far as I heard, there are 8,000 cases in India right now.
Yeah, around 9,000 now, and plenty
Okay.
for highest in Gujarat, and one of the highest in Rajkot also.
Oh my
Is
god.
that right? Is that
We are
because of the
operating 2 or 3 cases daily in our hospital? Other hospital operate 5 cases, 6 cases daily of mucormycosis. So it is that high, and we are facing lots of problem because there is a shortage of drug called amphotericin B. It's the drug for the mucormycosis, antifungal drug, which was not available initially. Now, since last 1 week, it is controlled by the government, and once you apply that, I have got a patient, I am operating, you please give this much injection, they will give it to you. But previously, because people used to do blackmail, they used to charge double, triple, whatever they feel, and patient has to give. Poor patient, there is no option, and nobody was. Now government raided this sort of people. They have arrested them. They have put them in the jail. So the Kara Bazaar of mucormycosis drugs, amphotericin B, is stopped. And but we have to stand in a queue like that to get the amphotericin B. So that is the problem which we are facing. It takes time, You have to spare your manpower, go there to the collector office, they will issue you amphotericin B certificate, then you go to the medical depot where you get the injection, and then you come to the hospital. So it's a waste of human time and energy, but because of this blackmailer, we have to face this problem.
So how effective is that? Is that medicine very effective if it is given early on?
Sorry?
Is the medicine very effective if it is given early on for the mucormycosis?
Yeah. But unfortunately, if you give earlier,
Right.
then it's goes, the spread of the mucormycosis is halted. But
Okay.
people come to us very late stage. Once they are
Uh-huh.
Oh.
starting some ulceration in the hard palate, some black nose, black part over the lip, over the nose, or red eye, when they are not able to open the eye, or sometimes behavior changes when it goes to the brain. So this sort of a presentation of mucormycosis, and it is harassing a lot, but fortunately it is going down also now. With the going down of the cases, it is going down, but it is the problem. And nowadays, another thing, white fungus started coming.
What?
Right. I read
Aspergillosis,
about it.
yeah,
Yeah.
aspergillosis started coming, but it
Uh-huh.
is
Oh.
very less in number, very few. So it's not the problem, but main problem is mucormycosis,
Right.
black fungus.
All right. So, thank you, doctors. That was very helpful. The next question is, can you please provide some detail? How can having a blood clot be dangerous?
So, I mean, blood clot, unfortunately, usually most people develop in the legs. When we're sick, we're kind of in bed. We don't move very much because we just feel tired. And that's kind of like one of the major factors, with the blood clot, when your blood is just static or when you just be laying in bed. And also having an infection doesn't help. It promotes blood clots to form also. The blood clot, while it stays in one spot, may not be particularly dangerous. It can be picked up and treated, but it can go to the lungs. That's usually probably the most scary aspect of a blood clot, and that can cause an immediate heart attack. Many times you could see someone looking well at 1 minute, and then 2 minutes later you could suddenly have a cardiac arrest. You can have a heart attack. And you're sitting here wondering, well, they just looked fine 2 minutes ago. What happened?
Right.
And sometimes that can be the blood clot. It just traveled. It doesn't take very long for a blood clot to travel through your blood and through all the vessels, unfortunately. So it makes every doctor kind of have to keep on their toes and monitor the patients very routinely and regularly, especially whether they're at home or at the hospital.
Right. And blood clot is most of the time kind of silent. So patient does not or may not have any symptoms at the time when the clot is forming. So nowadays they are using a prophylactic heparin, which is a blood thinner medicine, to control the blood clot. And blood clot is very dangerous, and it happens so frequently. In fact, in the first round of COVID here in New York City, there were multiple cases came across of having a pulmonary embolism and death. And that's when first time we as a human realized that this virus also causing a blood clot, because there were so many people dying at the time, and they couldn't understand that a patient did not decompensate respiratory wise, and all of a sudden patient just died. So that's when the blood clot came in a picture, they found out. And since then, all the prophylactic um, heparin and blood thinners started. Unfortunately, still in India, I heard that quite a few patients are dying from having a pulmonary embolism. That is a blood clot basically forming in the leg and traveling to the lungs and heart.
And one more interesting fact, there was an article came out. They said about 15 times one person with the COVID is 15 times more likely to get a blood clot, just compared to your average person. So the risk is real, and now it's starting to get published as well in scientific papers.
Right.
Yeah,
Yes, Dr.
absolutely
Modha.
correct. And we are getting more and more myocardial infarction, that is a heart attack, then stroke in the brain, that is paralysis, stroke in the leg, that is
Oh.
gangrene,
Hmm.
You see, Dr. Dakivaria saw us gangrene in the
Yes.
leg.
Yes.
This heart attack and brain attack, they are becoming more frequent. And I have asked to the cardiologist, what is the difference of normal myocardial infarction
Uh-huh.
and a patient having a COVID and getting myocardial infarction?
Mm-hmm.
So he says to me, Dr. Patel, Tushar Patel, he told me that the block in COVID is irregular and very long in the artery,
Mm-hmm.
and which is not stentable easily. While the other blocks in common people, when it happens, the blocks are shorter and they can bypass it and put a stent easily. So this is the situation of a COVID coronary artery and non-COVID coronary artery with a myocardial infarction. So these are the two differences they have mentioned to me, and uh, I think it might be correct because the COVID patient, when they get a heart attack, die on the spot practically. They don't give a time to reach to the hospital. One of my patients
Mm-hmm.
was operated by me 20 years back.
Mm-hmm.
He had a brain abscesses, multiple brain abscesses. He was operated around 1999. So I got a call. Then we developed relation like family relation. So he was coming regularly for follow-up.
Hmm.
One day he had epilepsy, means
Uh-huh.
convulsion,
Hmm.
seizure, fits, and we got a call for, uh, to bring him to our hospital. Our
Mm-hmm.
ambulance went there along with our paramedics. He was coming to the ambulance walking. We say, we'll put you on a stretcher. He was a big guy of 120 kg. So he said, no, I'll come walking. Just
Uh-huh.
he crossed his door and he collapsed there and he died on the
Oh
spot.
my
Oh,
God.
So we could not resuscitate him. They tried to resuscitate, but he was not revived and we have to declare him dead. So these are the sort of incidents happening in India, probably because of COVID.
COVID.
yeah, I have a question for Dr. Modha about with the COVID and heart issue, but there's also a significant number of people are chewing tobacco in that part.
Yeah,
Does that has any linkage to increase cardiopulmonary death?
yeah. It is they are more vulnerable to the coronary artery
Mm,
disease and stroke, both because their arteries due to tobacco has become toughened and tortuous, and there
Hmm.
is a already cholesterol deposition is there in the artery, and
right.
COVID produces the infection, one sort of it's a viral infection, no? So the artery get infected, get swollen, and the lumen of the artery is get closed, and suddenly patient get the heart attack or some brain attack. So these are the things we believe. Actually, we don't have a proof, means scientific.
Mm-hmm.
But what I believe, and we see in the clinical practice that
Mm-hmm.
the people who is tobacco eaters, people who is having a cancer, people having a diabetes,
Mm-hmm.
people having a blood pressure, they are more prone to develop COVID complication.
Hmm.
Mm.
And that is probably one of the reason of high death rate after the COVID incident. When COVID is regressing, but the
Mm-hmm.
death rate is little bit increasing. So this could be one of the reason of
Mm.
increasing death rate.
So with this platform, we should also educate the people that
Yeah,
they should, if they are chewing tobacco or if they are smoking, they should they should start weaning themselves off of those tobacco product, and that would also be that would increase the survival from
yeah,
the COVID death.
correct. And
Yes.
we are teaching them But you see, some people listen, some did not. So this is the situation in India. But we do tell them that stop tobacco, stop smoking,
Right.
stop alcohol.
Right.
Some of them
There,
take it
it's
by heart.
actually
Some
it's
forget
going
it.
up because of the lockdown. It's going opposite. They are smoking
Yeah,
more
Exactly.
and
Yeah.
they're drinking
Yeah.
more.
they sit and smoke. They sit and chew
E-
tobacco at home.
even
See,
drug
I will
consumption
tell you the
has.
reality.
Mhm.
Vajubhai, in
Ah,
between, I am telling you about the first lockdown when he had
ah,
last year.
right.
So they have stopped all shops of pan gallas, everything was closed.
Shut down. Yeah.
People used to, those who is addict to tobacco and cigarettes and bidis and all,
Yeah.
they piled a stock from the this vendor,
Right.
and it was so much so, but it get vanished. You see, they
Yeah.
smoke too much. When there is
Yeah.
no work, what they do? They smoke it or chew tobacco.
Yeah. Yeah.
So the stock was empty before uh, the lockdown opens. So they
Hmm.
were in worried, and they tried to bribe the person who is having a pan gala or pan shop, and try
Hmm.
to get the tobacco from back door. You
Ah,
see, and
yeah.
then
That's what I heard.
they were arrested. Almost 20 people in Rajkot got arrested.
Oh man.
So
Yeah.
tobacco is that demanding things in Rajkot and Saurashtra area.
Absolutely. Yeah. No.
Somebody just told me that કે પાન વગર તો હું જીવી જ ના શકું. એટલે મેં કીધું કે ઇન્ટરનેટ વગર જીવી શકો તો કે એક કદાચ પોસિબલ થાય પણ પાન વગર નહીં. And I was like, what? So pan
Yeah.
is more special than internet. And I'm like,
Pan,
okay.
Right.
Paki,
Mhm.
Paki, and
Hello.
what is else?
Mavo.
Mava.
Mao.
Mava is Paki, one sort of.
Okay.
Right.
And this thing, Vimal and all this. In our area, Vajubhai, females are addicted to this all, Vimal and
I
tobacco.
saw, I noticed last time when I came to Porbandar area, I think females are eating more than men now.
Yeah,
Oh my God.
It's
Yeah.
more
Yeah.
prevalent, it seems.
Right. Because they have easy access. They have everything at home. And they just make it at the tobacco and they just keep eating at home.
Um,
So this is the situation in India. But
Right.
slowly we have to curb.
Yeah.
Stop it.
Yeah.
I mean, woman empowerment, બધી વસ્તુમાં competition કરો, that's fine, but not in this, come on.
Not in this
No.
one. Right. Yeah.
So sorry to interrupt you, very good conversations, I'm not interrupting, but we have Jayesh Thanki who is asking us a question. Actually, he has two questions. I'm going to flash first one, which is, it is mandatory now to report cases of mucormycosis to Delhi now, seeing the surge of cases across the country, and it is also declared as pandemic. Jamnagar, we do have lots of cases. Special ward is open in Gokul, I think, hospitals.
GG Hospital.
Okay,
Guru
GG.
Gobind Singh Hospital, Irvin Hospital.
Okay, sorry, I'm not aware. I thought it's Gokul. So GG, do you have any cases registered in US? That's the question for you, I guess. Dr.
As
Rajyaguru.
far as I know, I have not heard the mucormycosis cases in America.
Mhm.
That doesn't mean it didn't happen.
Hmm.
But in America only the registration start when it is pandemic.
Mhm.
So we did not have a pandemic of mucormycosis, as far as I understand. So I have not read or heard in America, but in India, having 8,000 cases is a significant number of cases, and that is a byproduct of the treatment related to COVID. So that's why it is being discussed all over in media and newspaper. And unfortunately, this black fungus is a very deadly. person can survive from COVID but can die from mucormycosis. So I think that's why it is being discussed and also being registered in a different part, specifically in India, in Delhi. But that's a very good question from Dr. Thanki or Mr. Thanki.
Yeah, so it's Jayesh Thanki. So he also has another question. So I'll just flash that, which is, I think he's asking for himself, which is, I'm having acute back pain and presently under medications. I may have to go for surgery. Yesterday took 2 shots. It has helped in reducing the acute pain I had. In case if it comes back again, do you suggest couple of more before I go for planned surgery?
Well, if he has already made up his mind about having surgery, there is no need for going more shots, as far as I can understand. Because if the surgery is decided, then it's better to have decompression and relieve the pressure on the nerve, and hopefully that will relieve the chronic pain. And the shots are, if it works, then you can have it. In other words, let's say if one get an injection in the spine, epidural or transforaminal or facet block, we call it. If one get a relief for 3 to 6 months, then it's worth repeating. But if one get just a relief of 2 weeks or 3 weeks, and if somebody need that treatment every 2-3 weeks, then the better avenue is to have the decompression surgery.
Actually, Jayesh has a
Yes.
severe lumbar canal stenosis.
Uh-oh.
But because of the COVID situation, we are a little bit postponing. Then let the COVID get clear, then we will operate for his safety. But he has a tremendous pain, I know, and that is why he is suffering a lot. But I want to be on safer side. We are delaying his surgery for still 2 weeks. I hope things should be settled in 2 weeks' time.
So while we were discussing about mucormycosis, I guess Beena Thanki said that Wisconsin in US had these kind of cases. So maybe
Okay.
she is reading and keeping up.
Right.
Thanks,
Yes.
Beena Thanki. And Shubham Thanki has also commented that great knowledge from well-known doctors. And I think whatever we talk is going, I can test કે આપણે બોલીએ છીએ તરત જ પહોંચે છે. એટલે જયેશ Thanki also replied, thanks a lot to all the doctors. But moving on and keeping the time in mind, I would like to continue with the rest of the questions, which are very important. And so let's continue with that. And the next question I have is, what can be done to prevent these blood clots?
So I guess some of the simplest things, basic exercises, moving around, walking is probably the best thing one can do. I mean, if we don't feel too well, obviously we should take some rest, but we should be walking as well. Even if that is walking, walk to your kitchen if you need to pick up a glass of water. Walk outside around your, small area. That's probably the simplest thing anybody can do. We give those blood thinners, we do the injections, and they should be given. But at the end of the day, I don't think anyone likes to eat needles or take needles more than necessary. So
Right. The other important thing is hydration. When person, if they are diagnosed with COVID, they have an excess water loss from the breathlessness by taking breath in and out. So they need to drink plenty of water. Most of the time, the reason the blood clot happens is because in the deep vein in the leg, there is not enough circulation going on, and blood is becoming thicker and thicker because of the dehydration. So plenty of water, plenty of electrolytes, and walking around, as Dr. Neil said, and also having a blood thinner shots.
And one more thing, think I'll add to that. When you go on an airplane and you travel for pretty long distances, meaning greater than 2 or 3 hours, this advice applies to those people as well.
Right.
So that's pretty much the general population on even a non-COVID time or a non-COVID patient.
All right. Thank you, doctors. So moving on to the next question, which is, what do you mean by muscle weakness?
So basically, someone gets COVID, we don't move ourselves around for a couple of days, then people may start noticing difficulty, getting out of bed, even getting out of a chair, being able to even walk. And this is kind of a little different than muscle weakness, but you'll notice a lot of people, because if we don't hydrate ourselves very well, we get very dizzy when we start standing up. So we just find it very difficult to endure any sort of routine physical activity that we're used to, even if it is us just going to have dinner at a table or something like that. So, just symptoms affecting our normal activities. That's essentially what is meant by muscle weakness.
And is it like losing a muscle wasting? How much is that?
Yeah, there's like 1%. You can lose 1 to 1.5% of your muscle, like your what you call muscle mass or muscle bulk, just for every day.
Every day, okay.
That you're just laying in bed and being on a bed rest.
So if somebody is in bed for 10 days, they'll lose 10% of their muscle mass.
Oh my God.
And it will take a long time to regain back.
Mhm.
So it's very important to keep moving. Even if they are bedridden, they can still do certain exercise, moving hand, moving arms, moving shoulders, even legs, knees, hip, just by staying in the bed. So more they continue the movement, the less likely they will have muscle wasting.
Just even lifting the arms in the bed, for example, keeping it up for 10 seconds at a time, doing it maybe 10 times in the entire day. That's still better than nothing at all.
Yeah, I initially, when they declared work from home, I was like, oh my God, this is like, I don't like this working from home, right? So I was like, then it started after 3 months, I was working from bed. Like literally, I would work from bed. I would just wake up. No work from home. I'll detach my laptop from my 2 monitors. I would just be like, okay, this is becoming a lot, right? So it was like working for crazy hours, like 15. So then I told my manager that, okay, you know what? I'm going to work from bed because I don't have time. And she goes like, well, yeah, actually, I'm facing the same. And then we all complained and we changed the culture. We were like, this is not going to happen. So we forced everybody to take movement breaks, which is like every 2 hours everybody has to take a movement break. You can't schedule meetings back to back. So now we are practicing that because it's work from home, but it was so sudden shock for me because working from home, working from desk to working from bed. So if we don't take care, it's going to be, even normal people would get impacted with this muscle weakness regardless of them doing
Right.
anything or not.
Yeah, exactly.
So, and by the way, we have Manjari Thanki who is watching us live, and we expected not too many questions, but somehow we are getting too many questions today, Dr. Modha. So I think we'd have to take it. And she's saying, I had COVID and post-COVID, I feel exhausted soon. Do you suggest anything that I should take care in my day-to-day routine?
Of course, she should be taking multivitamin, some supplements, maybe B12 injection every 2 weeks, and change the diet, which is more healthy, more fiber food, those kind of things, and getting a plenty of sleep at night, exercising. In other words, we can enhance our health by modifying our lifestyle somewhat.
All right. So we also have another question from Shubhang Thanki, who is watching us live and asking us that after recovering from COVID-19, should I start exercise, and what kind of exercise I can do?
So, I guess start with the best thing is, yes, definitely should start with the exercise, provided not feeling short of breath. If you don't feel short of breath, you're not running a fever, definitely start with the exercise. Start basic with walking, increase your endurance. As you find yourself able to walk a couple kilometers a day, then if you feel like you were someone who were doing weight training before, you can start carrying bags of groceries and stuff like that. That's probably the easy way to carry weights. You don't need to go and buy those special barbells or anything like that.
Right.
And then, you slowly can increase that load. If you feel like you need to carry more, whatever you're going to carry in your backpack, just increase the weight of some of the stuff, but don't take too much weight or you're going to cause yourself back pain and knee pain, and then you'll have different problems to deal with.
If there is nothing in terms of exercise equipment, he can just climb the stair up and down 3 or 4 times. That would give plenty of exercise.
Yeah, exactly. That's the other good way.
Yeah, Dr. Modha, any comments?
Yes, correct. No need for going to the gym, but do simple light exercise
Right.
and gradually increase it as your body tolerate it.
That's
So
right.
that is what I want to tell.
Mhm. There is one more question from Veena Thanke, and she has posted it twice, so we have to take it, which is, how safe is swimming nowadays? Interesting, right?
Yeah, it is interesting. It depends if, as far as I understand from reading the literature in America, that swimming pools that are maintained with the chlorine and stuff, they are safe. But if the pool is not maintained properly, if there are not adequate chemical in the water that can kill the germ, then I don't know. But as far as COVID is concerned, I have not heard that COVID is being spread through a swimming pool. I haven't heard any case yet. If somebody knows, they can. They're welcome to make a comment in our show.
Already. So, Shubhang Thanke has said thank you very much. And Manjri Thanke, thanks a lot, doctors. But moving on to next question, કારણ કે આપણે હવે જલ્દી ઉતાવળ કરવી પડશે. There are a lot of interesting questions જે અમને share કરવું છે. So, next question is, what can be done to help prevent, reduce the impact of muscle weakness?
So I think a lot of it is we mentioned it and touched on it quite a bit in I think the previous question. A lot of this, the exercise, and even if you're in the bed, lifting your leg, keep it up for 10 seconds and put it back down. Arms, same thing. Stretch those palms, don't just allow them to be stuck together. Exactly. Just doing basic stretching, and that's about all we can do, It doesn't require any special equipment, and we don't need to spend a whole lot of money on it.
All right. So, thank you so much, doctors. Veena Thanke is like, અમને પણ એવું જ લાગે છે, Veena-બેન. Next question is, what are your thoughts about the new fungal infections being reported out of India? We discussed it, but maybe a quick short answer would help.
It's pretty bad. The problem is a lot of people are dying. But good news is Dr. Modha said that there is a medicine and it's very effective if it is given early on. So the most important message that we can give it from this platform is that if somebody is suspecting having a fungal infection, they should not wait. They should seek a clinical consultation, even remotely, if they don't have any, let's say, specialist in India in certain remote area and suspecting a fungal infection. Now they can do a virtual consultation and shipping the patient to appropriate hospital and get the treatment for the mucormycosis.
Thank you, doctor. So the next question is, I have been hearing this new term, long COVID, being used recently. Can you describe what this is for our audience?
So that's a pretty loaded term, actually. Long COVID is one of those, we don't know much about it yet, but apparently, there are people who have had COVID-19 and then they, despite being cured, or they feel like they no longer have any, the shortness of breath or the negative test, they get a bunch of different symptoms, whether it's nerve, muscle, brain, skin. There was one story we were reading a little while ago, right? They were talking about a man who, he had a mild COVID case. He never even required to go to the hospital, and he essentially He's now living with severe nerve-related pain, kind of diffused throughout the body. Spine is inflamed, so he just got a lot of inflammation in the spinal cord, and he's on like 10 different medications, including the steroids, which they're using to treat COVID-19 patients around the world right now. So, just because one gets COVID and is quote unquote cured doesn't mean that, that person's out of the woods. And I think that's an important message both for those who've had COVID and those who have not had COVID. If we haven't had COVID, this is another reason we do not want to get infected. So keep up with those basic hygiene and protection protocols.
And also important thing is to get the vaccine because if somebody has a COVID, the COVID variant can infect them again. And if they get a second infection, is likely to cause more damage to the body. And this is called a COVID sequelae, meaning even after COVID is gone or the person recovered from COVID, there are some residual signs and symptoms lingers with the patient. Just like Manjari Ben was asking about feeling exhausted and fatigue all the time, that's part of the COVID sequelae.
Yeah, definitely.
Thank you, doctors. So we have a listener who is watching us live. His name is Ishpreet Singh, and he's asking us, what is the third wave, or is it just a rumor?
There are good chances that India will have a third wave. Whether that third wave is going to be as big as second wave or not, hopefully not. But there are chances because the virus, unfortunately, from what we know in the short time frame about this virus, that this virus is keep changing, and as a result, it is becoming more and more infectious. It's a mutation, and third wave is very likely whether the whole country is going to face it or part of India is going to face it. That remains to be seen, but it is very likely.
What do you think? Is it also the same at a global level or just for India? What do you suspect about US?
Well, that one is hard to answer. It's unfortunately this virus, wherever it starts or wherever it mutates, it doesn't stay there. It immediately spread everywhere.
Mm-hmm.
So let's say if there's a mutation occur in a one country, and let's say that country happened to be not India, but can that mutated virus come to India and start all over again? Yes, it's possible. And that is the scary part, and that is one of the good reasons that everybody should get vaccine, because so far there is no mutated strain that escapes vaccine yet. So vaccine is 100% foolproof, and everybody should strive very hard. They should get vaccine as soon as it's available.
Thank you, Dr. Rajyaguru. So the next question, Shubham Thanki is already asking us the next question, which is, what are your thoughts about vaccine shortage? Well,
the vaccine shortage is, India is a big country with 1.3 billion people, and that size of the population will need lots of vaccine. India is the size of 4 times America as far as population is concerned. So whenever the vaccine becomes available for that age group, they should make every effort to get it. But until vaccine is out there, they should practice all the precautions like hand washing, wearing mask, and maintaining social distancing. And also avoid any risky behavior, meaning going out for no reason.
Excellent. So, yes, Dr. Modha.
Yeah, it is about the shortage now. We are facing little shortage, but in a short time, we will start Russian vaccine, Sputnik, then Bharat Serum vaccine, Covaxin, and Serum Institute of India, Pune, we are getting Covishield. So within a short time, the vaccine shortage will be over. And India is thinking to give more license to the pharma company to produce more and more vaccine. That is under consideration because of this WHO restriction. They don't want to, what should I say? They don't want to share their business secret about the vaccine
Right.
to the other pharma company. That's why this is happening. But I'm hopeful that it will be sorted out soon.
Thank you,
And
Dr. Modha.
I just read somewhere that Sputnik is also going to be manufactured in India.
Yeah, it is by Reddy. Reddy
Right.
Pharmaceutical
By Reddy
Company
Pharma,
is
right.
being
Exactly.
manufactured, and the other lots to give to the people, that is also available from Russia. So there is, I think, in a short time, there will not be a shortage. That shortage part will be over.
Excellent questions and excellent discussion. Dr. Modha, we have leniency to take more questions, right? Okay, we have to be mindful about the time. What do you think?
How many questions still remaining?
We still have at least 3 questions. Last 3.
Okay, finish it fast.
Finish it right.
Now
Okay.
we will not talk in between.
Okay, so we have a lot of interest from our live listeners. What can I say? Excellent. And still people are interested in asking more questions. But the next question is very important, which is mental health has become a recurring theme of potentially uprooting society even after this pandemic comes down. Can you please describe some of the possible mental health conditions one can suffer from and how to address them?
We briefly touched based on that, depression, anxiety, sleep disorder, family issue. Dr.Neil is going to shed some light.
Yeah, you got PTSD as well,
PTSD, right.
And it's not just for the people who have the COVID diagnosis, we're talking about family members as well. So
Right.
I think that's also a very important point that, we're putting a lot of the attention on people who get diagnosed, but one person get diagnosed, the entire family unit gets affected as well. So I don't think any of us are safe, from the mental health component. So we should all be mindful. That's the main thing, and how should we address them? First off, I think, as a society, we should try not to be so judgmental of these people. Anyone who does happen to develop any of these disorders or age difficulties, this is a very unusual time. And, whether family, friends, or a professional is needed, that should not be frowned upon or judged in a negative light. We should make it easy for people to get access to this care.
Right.
By whoever can give it effectively.
Mm-hmm.
There is no ego. There is no. There should be no roadblocks for this kind of care.
Right.
Medication is not the only way too. I think that's probably the other thing to think about. Sometimes just having somebody who you can talk about your problems with. Having good family relations or good friend relations, or sometimes even the random person on the street. Some people, those are all different ways that one could address it. Just being more open about mental health in general.
Sometimes it can be as simple as just going on a beach and take a walk, and you can relieve all the anxiety and issue that one is withholding because of the lockdown. Yeah. So people are frustrated with the lockdown, and once they get out and they're able to do more things, I'm sure the psychological problem will slowly wane away.
I mean, they also say that those who exercise, naturally those endorphins get released, and that promotes happiness and decreases a lot of this psychological negative feeling.
Yeah.
I totally agree with that statement. Exercising is the best way to get away with anger or get away with anxiety or any kind of stress. Just that helps a lot. At least it's helping me getting rid of my stress. So we have a comment from Shubhang Thanki, and specifically this is a great comment, so I do want to share. He's saying that it's great to have advice from well-known doctors from US and best from the proud of Gujarat, Dr. Modha. Thank you so much.
Thank you.
Yeah, this is huge, Dr. Modha. When we started this program, we did not know where we would go or how, but Dr. Modha has been like persistent. Ke na karu chhe la karu chhe. And now we are here. So the last question I think that I have, yeah, I think the second last, which is, we have spoken a lot about those diagnosed with COVID. What kind of pain does a family suffer as a result of a loved one's diagnosis? Very important question, right?
I think it's very similar. I think that those who are actually diagnosed with the COVID, like the pain would be more of an emotional, mental, sometimes even physical. People are not eating as a result of the stress and anxiety they're feeling over their loved one. That can decrease their immune system. That can decrease their ability to fight off an infection if they're going to get it. You don't want that to happen. Sometimes some people, because of the stress, they can, let's say they had a pain that was under control, they could suddenly be putting themselves at risk for even more other chronic pain conditions in general.
Right.
Whether if someone has a bad, terrible back pain, and all of a sudden they get to the stress, they might be sitting in the wrong position. They might not be so mindful of their health and all the other precautions they've been doing to keep themselves out of trouble for so long. Diet, people, a lot of us, we feel stressed, we stress eat. We just keep on eating any item that we see because it takes our focus away, from all the stress and anything that we have going on. So we gain weight, and then that puts us at risk for other medical conditions, whether it's heart disease or, you name it, stroke, amputation, gangrene, whatnot.
Right, Dr. Neil. So, the next question, and I think this is the last question. So, listeners, just one instruction to all of you, one request. If you have any more questions, I know you all have, right? Karan ke both have it, check questions. Don't worry, you can always comment there. I will share with our doctors and they will get back to you. Okay, chinta karwani jarur nathi. We have got you covered. So, the next and the last question for today's show, which is, how can we help those diagnosed with COVID through their recovery?
That's a loaded question there, but important that we should at least address it. If someone comes, I think as a physician, as a doctor as well, if someone comes and says they're not feeling right, we shouldn't brush it aside. We should take it seriously, because we truly don't know what COVID can do, in the long term. This is a new disease, and we just need to have an open mind. I think that's probably the most important aspect of this. And if someone has a condition, try our level best to work it out, whether it's in the US or in India or any other country for that matter. And offer whatever we can, understanding that we're going to be constantly learning about this with every passing day as the scientists and the physicians and society at general at work.
Yeah, basically supportive care. If somebody had a COVID and recovering, make sure the nutrition is right, exercise is right, sleep is right. The person need to bounce back from the COVID situation and take control of his or her life and move forward. Any person is a smoker or chewing tobacco, they should cease, they should stop doing that. And basically the recovery will occur, will happen.
Thank you so much, doctors, Dr. Rajyaguru and Dr. Rajyaguru. This was an excellent, excellent show. You have seen a lot of response. Even the early morning in India, people are they are awake and they are responding. It's late night in US. Even then, they are responding, which is cool. Didn't expect this at all. So, all the thanks to all the doctors for donating your time. And I know there is a quote, time is money, and this we are doing for free, literally. So there is no money involved here, but still you guys have been there. And a special thanks to Dr. Modha for his leadership on this program. So Dr. Modha, a few words from you on who is coming tomorrow, and then we'll wrap up the program.
Tomorrow, Dr. Selvan, HOD and Professor of Neurosurgery from Kanyakumari. He'll be talking to us about COVID and neurospine surgery. And the other girl,
Young girl.
very young girl, just passed MBBS
Mhm.
with 8 gold medals. 8
Excellent.
gold medals, 8 gold medals. She'll be doing counseling for the COVID patient. So we have involved her also in our program. And she'll be talking to us about the counseling in COVID. The majority of it we have taken today's discussion. And that is for tomorrow at 9 a.m. Indian time. 9 a.m. Indian time.
8:30 California
Your-
time, and I
your-
think
Forget Florida time.
I don't have to say that. It would be very late.
Around
Middle of the night.
But it's quite funny when people watch YouTube videos, right? So all our recordings are on YouTube, and I get pings and dings even at night, and I feel like, oh, isn't it too late for you guys? And like, oh, I was just surfing, I bumped upon your video, and it's so cool. So nowadays I start getting those dings and pings even from like East Coast, even if it's late night. So yeah, the response is quite cool.
No, some people don't sleep. But I just want to take a moment to thank
Yes.
you, Mirchita, for doing this for community, and also thank you, Dr. Modha, for providing such a valuable information and making it accessible to the society at large.
Yes, thank you. And
Thank you so
for
much.
coming.
Thank you for coming on the
And
show.
all listeners
Thank
have
you.
also enjoyed, it seems, from the question we are getting.
Yeah,
So
yeah.
we are also very much thankful to you for donating your time, and hope in future we can involve you more and more in this
Sure.
sort of a social program, or even for a medical man about your expertise. So let us hope God give us a courage to do it. And we will do it.
Maybe we should. I really want to promote this thing where we can say that we should have a doctors without boundaries, right? So
Yeah.
the boundaries are artificial, so we should have doctors without boundaries, where two doctors from different global doctors, from different nations can connect and talk about their experience. Even that would help people.
Yeah,
So
Yeah.
that's
Yeah.
a long-term plan.
Yeah.
Yes, and that is a must, because in America, I know the situation. That's why I have told once, probably
Yeah.
Neil may not be knowing. One of my friend, Neil, can we end this thing?
Yeah. Okay. Thank you, listeners. We will come back tomorrow. Thank you.